over time, with things such as aging, sun damage, then people do unfortunately get some quite thin areas developing in these parts of the face, and that leads to the crepey appearance, which is... Hi there, it's Dr. Kandola, and I've been asked to have a little chat about a few FAQs. So one of them is regarding crepey skin. So that's the kind of skin that's almost like tissue paper, and commonly is around this area of the face or this area. So when people are smiling, they find very fine lines here. So it's usually due to thinning of the skin, often happening more so in people with quite fair skin, but it can happen to anybody, and clearly happens with advancing age. The three aspects to this topic would be: what is it, how do I prevent crepey skin forming, and how, once it's formed, most importantly, do I treat it? So the characteristics of crepey skin would be thin skin on the face, usually around about this area in the mid-cheek or the higher cheek area where people are smiling. It could happen anywhere, but they're the most common areas because the skin's thinnest here and it's a very dynamic area, so there's lots of movement which is repeatedly causing the skin to fold. And over time, with things such as aging, sun damage, then people do unfortunately get some quite thin areas developing in these parts of the face, and that leads to the crepey appearance, which is sometimes as severe as almost a translucent appearance to the skin. But for most people, it's just the early signs of wrinkling. So, one of the common questions is how can I prevent crepey skin forming? Well, the easiest thing to do is wear good sun protection, so have a good factor of SPF, and also take proactive preventative measures in terms of your skincare regime. So that's maintaining hydration with a good moisturiser, and then slightly more invasively would be using skin boosters such as mesotherapy, or profilo treatments, or microneedling, or micro threads with PDO threads. So one of the commonest questions I have is, how can I prevent crepey skin from forming? Now, the easiest thing you can do is use a really good SPF for sun protection. The other thing is to moisturise your skin. But then when you start to think about slightly more invasive things, then we'll be talking about microneedling, mesotherapy, profilo, micro threads, skin boosters. All of these things slightly traumatise the skin and lead to the reparative process from fibroblasts in the deep reticular layer of the dermis to cause a tightening. So those are the common ways I use sort of for my patients. It works really well. So how do I treat them once they're present? Right, you do all of what I've just said about prevention, and then we're looking for a cure. So they say prevention's better than a cure, but when you need a cure, you still need some preventative measures as well to stop them getting worse. Now, we'll ignore the things I've already mentioned, and specifically, some really good treatments for crepey skin would be to use a cannula with dermal fillers. So the cannula is a blunt-ended implement, about this long, and what I do, if you imagine the smile lines going from here down the face, if then I put a dermal filler at 90 degrees to these smile lines and layer it just under the surface of the skin with quite a soft dermal filler, such as a Bellatero Soft, for instance, then that leads to some gain in structural integrity and also rehydration of the deep part of the dermis. So that would be one method of doing it. Another one would be to use profilo. So profilo is a skin booster, often used in combination with the Bellatero Soft in my practice. And what you find is that the skin regains its glow and has quite an aggressive hydration. So both of these things last in the region around 6 months. Course of profilo and some aggressive rehydration treatment with cannula. So a further treatment that's really good for curing crepey skin would be Alancey. Now, Alancey is a type of dermal filler which also has pro-collagenetic properties, so it increases the amount of collagen in the skin, and it does that by depositing microspheres of a chemical called CMC, and that chemical is in the deep layer of the dermis and irritates the fibroblasts, which then create more collagen. There's a theme here: everything we do irritates fibroblasts and produces more collagen. So further to the Alancey, to one side, would be some micro threads. Micro threads go just under the layer of the dermis, and they're made of polydioxane, PDO, and the PDO irritates the fibroblasts, produces more collagen, depositing a tract of collagen, which if it's placed in the correct vectors will tighten the skin. So often I'll use microthreads in combination with PRP, which is platelet-rich plasma, which you may know, but if you don't know, it's where I extract blood from your arm, put it in a centrifuge, and distill it into a portion of PRP, platelet-rich plasma, and a proportion at the bottom of heavy red cells. Discard the red cells and use the PRP, which is rich in growth factors, in concert with the microthreads. So once I'm putting the microthreads in, I'll put the PRP around the microthreads, and that will engender a really strong collagen response. So this is quite reliant upon your body's reaction to a stimulant, in this case trauma. And through the process of mechanotransduction, we have splitting of collagen fibres, fibroblasts get irritated and create more collagen. And in the presence of the PRP, it's almost like a fertiliser. The growth factors there make this all accelerate, really giving the skin a nice tight glow. So, another question would be, how long does this all last? Well, I'd put it to you that it's not how long it lasts, it's more of how often do I need it to maintain the excellent results once achieved. So I would say that's split into two questions. How long to see a result? And I would say that depends furthermore on the treatment. Broadly speaking, somewhere in the region of 1 month to 1.5 months, because most of the time with these treatments, I'm reliant upon your body reacting to the treatment. But once it's there, as long as you upkeep it every 2 to 5 months, then it'll be quite easy to maintain the good results that you get. However, obviously this is individualised. Everyone's unique, so if you pop in for a consultation, I can give you a more accurate answer. So the last question I had was, what's the downtime? Great question. Broadly speaking, a couple of days. So there are instances where bruising could happen, in which case it would be slightly longer than that, and some people are absolutely fine the same day almost. It does also depend on the exactitude of the treatment at hand, so of course we'll discuss that more at your consultation. Thanks very much for taking the time to watch this video. Please do feel free to contact me in any of the ways outlined before, and I look forward to seeing you again next time.